This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak, and let me welcome you back to Aurora Medical Center in Oshkosh. Now today we're going to be heading over to the Cardiology Services Department, where we're going to sit down with electrophysiologist Dr. Mortada. You may remember him. Kind of an electrician for the heart. Now today he's going to be talking about a cutting-edge piece of technology that's not only helping to detect but also treat people that deal with heart palpitations. Well, thank you for joining us. I know you're a very busy man. You've got a lot of things going on, especially with this 3D mapping system. It's a very exciting time here at the medical center, isn't it?
Yeah, it is. Actually, we were waiting for this for the last 5 years, and finally we have it here now. We're so excited about it.
Yeah. So what's the advantage of a 3D mapping system?
So basically, when we have a patient has palpitations, they come to see us, and we found there's some rhythm problem. The heart is a three-dimension structure, and it's sometimes very difficult to locate the location of this rhythm problem. So 3D mapping will be very helpful to kind of precisely know exactly their location. Yeah. And that technology has been in the market for a few years. We've used it in Milwaukee, and in this area, it's kind of new to have right now. This is going to be our first procedure. The advantage of that mapping system will make the duration of the procedure very short, and will make it more easy for us to locate the arrhythmia.
And you mentioned it is a very relatively quick procedure. You gave us special access into this procedure. We want to take a quick look at a little bit of this 3D mapping system procedure.
This is the catheter, which we're going to use for the mapping. It has a sensor at the tip where the map system will be able to detect where is this catheter in the 3 dimension. So using the X-ray machine, we'll be able to kind of direct our catheter into the heart. As soon as it reaches to the heart, we'll be able to locate that catheter on the 3D mapping. So when I'm moving my catheter, that we can create a shell that can see on the 3D mapping how the catheter is moving. The software is sensing my catheter and creating a shell where all the edges of the right atrium, I'm in the right atrium right now. So I move the catheter against all the walls of the atrium and creating line or collecting points in the 3 dimension.
It was amazing. Thank you for taking us into the procedure room. We just saw a very small clip of that. How long does a typical procedure last?
So if I don't use the mapping system, it might take me between 2 to 3 hours to finish the procedure.
Without the mapping
Without
system.
the mapping system. If I use the mapping system, I might eliminate at least an hour of the procedure, because that helps me to locate the electricity where its location, and helps me not only that when I'm doing the ablation, which is cauterizing the tissue, which is creating the rhythm problem, the mapping system will take some points for me, will locate exactly where I ablate. Because sometimes you do the ablation and then you move your catheter in different location of the heart, and then you forgot, okay, did I ablate in this location or not? And then that will take you a little bit more time to map more without the mapping system by looking at the electricity only of the heart. So now with the mapping system, you don't only look at the electricity, but also you can look at the 3 dimension of the heart. And also you can take points where I did the ablation. So that will be very helpful for me to expedite the procedure to have it more successful. And actually there are some studies showed for a specific rhythm like atrial flutter. If you do the mapping system, you improve the success rate, not only the duration of the procedure, but the success rate of the procedure increased from 80 to 95%. So you increase the success rate significantly. And if you're a patient, what do you prefer? You prefer to have a success rate of 80 or 95% with the mapping system? Of course.
Yeah.
the answer
Anytime
is,
I can increase my odds, that's a good thing.
Why to come back twice?
And I would imagine one of the other advantages is the convenience. Now, the way I understand it, you can also diagnose and treat in many times at the same
Exactly.
time?
It's the same setting. You do the electrical evaluation, you do the mapping, find where it is. The mapping system is not only a diagnostic kind of help me to diagnose, but also help me to, as I mentioned, the treatment. When I do the ablation, the annotation of the location of the ablation point will be collected on that mapping system, and I will see exactly where is the location. That will be helpful. And after the mapping system, sometimes we do testing. So I paste from one location, and I map the electricity where it's going through. So if I did ablation, linear ablation in one location, and you paste on one other, on one side, you get to see the electricity travels this direction, and then it stops, and then goes around that linear lesion around that line. Then with the mapping system, you can tell that is happening. If I didn't have a mapping system, I will not know. I can pace and I can measure some areas, but it's not really great for me to be 100% that this area is completely destroyed and this area is completely ablated.
It's incredible technology that you're able to use. Are there any disadvantages to using this system?
The only disadvantage I see with this is a little bit expensive, and that's the reason why we're kind of working out to get. We've been working on this for the last 5 years to get this system here. Some more disadvantage to the patient, less disadvantage for the hospital, but disadvantage to the patient is basically is a little bit more expense for the procedure as well. And I will say, if I'm a patient, I'd like to have my success rate the highest with the least duration of the procedure, and I will pay the extra money for that. Mm-hmm. And it's not significantly high, but it's a little bit more expensive. That's the only disadvantage I will see, because really it doesn't affect the patient. It's patches from outside, basically the expense of the patches. That's about it.
Is there much to a recovery time from this procedure?
Because of if you think about it, if your duration of the procedure is shorter, you recover faster. But I will say the bed rest time after the procedure is maybe almost the same. The ablation will be less, so your pain will be less later on. Mm-hmm. So definitely there will be more advantage from that standpoint.
Increase your odds, less pain. I think
not?
you're onto something here.
Exactly.
Thanks for taking some time with us today.
Thanks a lot.
As you can see, this is an amazing piece of technology, and when it comes to the Fox Valley, you can only find it in Oshkosh at Aurora Medical Center. Now, if you have any questions about what Dr. Mortado was talking about or any of our topics, you can always give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.